We want to talk now about what is, I think, unquestionably our most important motor system, the corticospinal tract or pyramidal tract. Are you ready for a shock? Can you handle a shock? All right. What would you say if I told you that this corticospinal system actually started out as a descending, long feedback system from the cortex, and its only job was to modulate incoming information coming up tract systems like the posterior column medial meniscal tract.
No. Can't be true.
The answer is yes, really. And it's interesting, in the rodent, you still find most of the fibers up in the posterior column area here, rather than here in the lateral column where we've come to expect it to be. Over time, some of this descending cortical feedback, if you will, transferred itself to progressively more ventrally located cells in the interneuronal pool. They began to modulate motor neurons, and finally, in large primates like gorilla and chimpanzee, and even larger primates like humans, about a half of the descending corticospinal system directly innervates on motor neurons. And the other half, interestingly enough, still maintains its love relationship with the sensory neurons of the dorsal horn. So even today, a very reasonable part of the descending corticospinal, a motor tract, innervates and modulates neurons in these upper laminae that are still sensory receiving neurons. A very, very interesting situation. Now let's start at the beginning. Corticospinal tract originates in pyramidal cells, that is long axon cells, in the hemisphere. We used to think that it originated, everybody say, oh, it's a motor tract. It must all originate in the motor strip area, area 4. Where's area 4? Area 4 must be right here. Well, I want to immediately disabuse you of the fact. It originates with almost equal intensity from motor 4 here, from the sensory strip right behind it, areas 3, 1, and 2, and with decreasing density from parietal cortex back here, and from more anterior areas of frontal cortex. So it has a very wide source of origin. And do remember that. We'll talk a little bit about the areas that it receives fibers from upstairs, because in addition to area 4, the motor strip, it receives fibers from the area right in front of it, which we call premotor, or area 6. And from a little area at the top of the area 6, it's a wonderful little area. It's called the supplementary motor cortex. That has a whole story all its own. And even from areas anterior to that. Now the pyramidal tract, the corticospinal tract, has about 1 million fibers on each side. Haven't counted them, but I'm told it's about 1 million. The majority of these, interestingly enough, are small axon fibers, which we found difficult to understand. And a very reasonable number of those are unmyelinated, which we found even more difficult to understand. You see how difficult everything is to understand in neuroscience? Anyway, only about 3 or 4% of that 1 million fibers are large axon, heavily myelinated, rapidly conducting fibers, which you'd sort of intuitively expect would be true about the whole contingent if this tract were really what we expect it to be. Now what about those 3 or 4% of fibers that are the largest axon, most rapidly conducting? Well, they all come from a small elite group of pyramidal cells. And I'm very fond of these cells. They're known as the giant pyramidal cells of Betz. Giant pyramidal cells of Betz. Who was Betz? He was a Russian neuroanatomist, I guess, who first described it. What characterizes a Betz cell? Well, it's a large pyramid. Some of them are up to 100 micra in size, which means that a really large Betz cell you can see with the naked eye. But there are only about 30 or 40,000 of them per hemisphere, which is virtually nothing. When you think of the millions and millions, the hundreds of millions of neurons everywhere, 30 or 40,000 Betz cells per hemisphere is nothing. Now here's another shock. Since these are elite cells, they're so large. By the way, I did a couple studies on the Betz cells, and the remarkable thing is that every one of them is unique in its structure and its dendritic arrangements. I got so literally, I could recognize every Betz cell that I looked at. And since there aren't that many of them, you can remember them. It's quite remarkable. But we always thought that the Betz cells would be the cells that would innovate the finest functioning muscle components via the motor neurons, of course. And that's wrong. See, everything is wrong. Everything that you attribute to the cortical spinal system turns out wrong. Where are the Betz cells found? They're only found in those parts of the cortex that innovate what I call the large dumb muscles. What's a large? It's not fair. But what is a large dumb muscle? It's a big anti-gravity, usually an extensor muscle. So in other words, in my body, the major anti-gravity muscles would be the muscles right across my pelvis, glutei and so forth, and the muscles, the extensor muscles in the leg, and to some extent, of course, in the lower leg and foot, the ones that keep me upright against gravity. Those are the muscles that this small elite core of pyramidal cells, the Betz cells, innovate. What do they do to them? You won't believe it. See, there are so many things you won't believe it. You see why I held this until you had a rest. It's shock after shock. A Betz cell apparently does nothing but inhibit. And it says no. It briefly inhibits the extensor motor neurons just before the actual program that the cortex wants is sent down via the rest of the cortical spinal axons. So look, I'm standing here talking at you, and I decide for emphasis that I'm going to move forward a step. Just before I make this graceful move, the Betz cell removes anti-gravity tone in the extensors. Just at the time that I begin to get floppy and run the risk of falling under gravity, right? The program comes down and moves me over here. Now I'm in the new position. And automatically, as soon as I'm in this new position, extensor anti-gravity tone is reestablished in those extensors, and it's reestablished by another tract we're going to talk about in just a moment, for the vestibulospinals. So this massive, this elite group, small group of cells, their only role is to selectively remove anti-gravity tone so that you can move more gracefully, more easily, more fluidly. Now here's the lugubrious part of the story. As Mark Antony said in Caesar, it says, if you have tears to shed, prepare to shed them now. The Bett cell is perhaps the earliest large neuron to begin spontaneously degeneration in the later parts of life. Probably around the age of 35 or 40, depending on the individual, Bett cells begin to show degenerative changes. And by the time you're in your 60s or 70s, the Bett cells themselves may well have disappeared. Does that tell you anything about me? You're probably looking at a man totally without Bett cells. Now, the point is I get around still, but not with the fluid motion and grace that I knew 40 years ago. I can tell it very easily if I go down the stairs. You could run down 3, 4 steps at a time as long as you hold on to the back. I can't do that now because I can't program that. I can't get the anti-gravity muscles to remove their tone, to relax that brief instant before I make the next step. It's probably why great athlete, a great gymnast is old by the time he or she is usually 20 or 22. Great pitchers are old by the time they're 35 or 40, right? That's one of the factors that are probably involved, this programmed deterioration of this very special population of cells. So I just wanted you to remember that. Now let's follow the pyramidal system down. The cells gather, of course. They are emitted from the cortex where they lie. They enter the white matter, and then in the white matter, as they're running progressively deeper, they make up this massive white matter area that has an interesting name. It's down on your sheet. It's known as the corona radiata. Strictly descriptive. What does it mean? The radiating crown. It's a great mass of fibers that are coming together as they go more deeply into the depths of the hemisphere. And when they get down this far, they come through an area of a good deal of compression, a narrowed area between thalamus here and basal ganglia here. And this narrowed area, which is a term we've already used, is known as the internal capsule. A capsule of fibers densely compressed together between thalamus more medially and basal ganglia more laterally. And in this area where everything is so tightly compressed, this is an area which, as we've told you, even a small vascular lesion can do terrible damage, so-called stroke. Now, once these fibers get through the diencephalon, they enter the next level of brainstem below that. What do we call that level? What's below the diencephalon? Mesencephalon, of course. And here they're located in the base of the mesencephalon in a structure, we've mentioned this in the past, it's known as the cerebral peduncle or crus cerebri. It's on your sheets. The cerebral peduncle or the crus cerebri, simply a continuation downward of all the fibers, descending fibers coming from the cortices, including the relatively limited number of pyramidal or corticospinal fibers. They continue on down and enter the brainstem segment below the mesencephalon. What do we call that? The pons, right? Enter the pons. And actually in the pons, they're sort of pulled apart. You notice? They're sort of distributed a little bit by the development of this massive group of fibers that are going to form the middle cerebellar peduncle or pontiobrachium. We'll learn about that when we get there. Our main job is to follow the corticospinal or pyramidal fibers downward. So they live through the pons, they get gathered together, and here they're running now in the base of the medulla, in a very special structure. To somebody or other who obviously needed eye examination, it looked pyramidal. And this is where that term, pyramidal tract, comes from, because of a presumed pyramidal shape and cross-section of this corticospinal descending system in the base of the medulla. Now, when we get down almost to the most caudal end of the medulla, then between 75 and 90% of these corticospinal fibers cross or decussate. 75 to 90% cross or decussate. And they now form the crossed, or as we call it, the lateral corticospinal tract. And that's the one that actually enters the spinal cord just below, gives almost half its fibers to the sensory areas of the gray matter, and the other slightly more than half of its fibers to the motor neurons and to the final common pathway here, and then the motor neurons get the hint, as it were, and carry the information out to the muscles. So this, you see, is the great descending pathway of this pyramidal tract or corticospinal system. Now I said 75 to 90% cross as they do to form this lateral corticospinal tract, and that we find in the lateral funiculus, or lateral white matter. Somewhere between 25 and 10% fibers don't cross, and for the moment continue on down, and those, that remainder, we find in the anterior white matter of the spinal cord. But they're really fakers, because when they get exactly where they're going, they sort of dot across the midline, surreptitiously trying to fool us, and they also innervate motor neurons. Now, in general, this so-called uncrossed anterior corticospinal tends to innervate primarily the more medial motor neurons. See over here? And those, you remember from a lecture or two ago, the motor neurons that are located more medially innervate muscle masses that are closer to midline. Whereas the fibers that bravely cross here and become lateral corticospinal, they tend to innervate the more laterally lying motor neurons, and those are the ones that would be more involved with the more peripheral musculature, particularly of the extremities. So this is that most important upper motor neuron system, the pyramidal or corticospinal system. And what it does is, we say I'm never really satisfied with this definition, but it's the common one, and I'll use it because you find it in all the books. This brings down voluntary motor commands to the motor neuron. So every time you change your position in your seat, or decide to make a note or something of that sort, it's the corticospinal system, driven by this very wide area of cerebral cortex up here, that is bringing down the specific commands for the spinal motor neurons to effectuate. Let me show you another picture that shows you something of the distribution. Well, first of all, let me just show you this. It's a cartoon made by Cahal, but effective, showing here typical pyramidal cells. Here are their axons, with the corona radiata here, through the somewhat narrower internal capsule here, then continuing down. This would be about the position of the cerebral peduncle or crus cerebri, and the pons would be down here and so forth on down. And just to show an actual dissection, this is rather nice. There are a number of plates like this in the hallway. Notice that you have cortex, you see the masses of fibers, both afferent and efferent, making up the corona radiata. They begin to get compressed. We don't see them here, they're cut, but here they're compressed in the internal capsule. We almost see them, not quite, in the crus cerebri, cerebral peduncles. And here they enter the pons, where you see they're separated by the intrusion of pontile cells. And then they get together again here, and they form the pyramidal tract, and this tract will decussate just below where it's cut off. So a nice picture. And then this cat, rhesus monkey, chimpanzee. Notice in the cat, which is still a little bit more like the rodent than we are, notice that the termination patterns for these fibers are almost entirely in this interneuronal pool. And then the interneurons secondarily feed the motor neurons down in here. When we get to the rhesus monkey, it's beginning to be a little bit more like us. Tremendous innervation of sensory pool cells. But notice here, more innervation in the motor neuronal areas. And when we get to an almost like ourselves, this is a chimp. Large corticospinal tract. And notice how the shift down, still sensory, but look at the density of innervation in the motor neuronal pool area. So this gives you some idea of the growth, the acquisition of direct corticospinal control on motor neurons. By the way, you folks haven't asked any questions, and feel free always, ready to make a point that I want these things to be clear. If you want to differ with me, if you have new information, by all means bring it in. Okay, let's look at one or two more tracts. I'm not going to handle all of these. I just want to play off two more descending tracts against the corticospinal pyramidal tract system. Now the first one that I want to play off against it is one we call the rubrospinal tract, and again, drawing from your coloring book. Now up in the midbrain, the mesencephalon, is a large nucleus. It looks very much like a small volleyball, actually. And it's called the red nucleus, or nucleus ruber. It receives a tremendous amount of information from the cerebellum, and also we'll learn about when we get there, and a lot of descending information from the cortex. Now, this red nucleus, or nucleus ruber, sends many of its axons, starting here. Disregard this. Starting here, it sends its axons immediately across midline. See, it's an immediately cross tract. And then they descend as the rubrospinal tract down to the pons, to the medulla, and to the spinal cord. And in the spinal cord, we're going to find the rubrospinal system runs just below and slightly overlapping the corticospinal tract. Corticospinal, or pyramidal, we've just been discussing, it is right here, and the rubrospinal is just below and overlaps it slightly. There's a lot of discussion about just how far the rubrospinal descends. Does it go all the way down to the lumbosacral cord? Does it stop maybe at the thoracic level? Not 100% clear. But at least see the fibers, we're sending collaterals and terminals into the interneuronal pool. Notice that the rubrospinal, in general, does not directly innervate motor neurons. It works through the agency of interneurons. And then, of course, those innervate motor neurons and those go out to muscles. What does the rubrospinal do? And I must admit that in humans, it's not 100% clear. I can tell you this, in the cat, in your cat at home, assuming you have a cat at home, the rubrospinal is perhaps the most important descending motor tract system, more important than the corticospinal. And what the rubrospinal innervates is the flexor muscles. See, it's a cross tract. It innervates primarily flexors. And if you look at your cat looks almost, you might say, perpetually flexed, ready to spring. And that perpetual flexion posture is apparently the product of an active rubrospinal tract. It must do more than that, because in the cat, a rubrospinal lesion tends to be as crippling as a pyramidal or corticospinal lesion is in humans. In you and me, if we could have an isolated lesion just destroying rubrospinal system, we would probably have very little discomfort, very little problem. Might for a few days be a little awkwardness, a little extra stiffness and muscle activity, but in general, no severe symptoms. Whereas obviously if we have a corticospinal, a typical upper motor neuron, then we're in real trouble. It's the other way around with the cat. A corticospinal lesion in the cat leaves the cat awkward and troubled for a few days, very quickly gets back almost all of its motor activities. Whereas a rubrospinal lesion leaves you with a really partially paralyzed cat. So this shows how these systems in their importance have varied over time. Now what about the role of the rubrospinal in humans? From what we can see, it works very closely, sort of as an adjuvant to the descending corticospinal system. And some people have suggested, and I'm not comfortable with this, but I've seen it in the literature, that the rubrospinal in the human helps with the activities of hand and fingers. And that if you have an isolated rubrospinal lesion, you have awkwardness of hand-finger activity. As I say, I take this with something of a grain of salt, but there's something to remember. The last two tracts we're going to talk about today. Let's first talk about the vestibulospinal tract. From the terminology, it must have something to do with the vestibular system, and it must project down to the spinal cord, both of which are absolutely true. Now, how many of you here have had some contact in school or otherwise with the vestibular system? Does everybody at least know what it means? I see. All right, good. I'm glad to know that, so we can tell you roughly what it is. It's essentially the balance system in the inner ear, made up primarily of the semicircular canals and two little adjacent systems, all of which are continuously monitoring our position in three-dimensional space and our movement or acceleration in three-dimensional space. It's an old system. We believe that it first came in order to make it possible for rather primitive vertebrate animals to maintain visual fix on an area of interest even as they were moving around. It becomes much more important when we're out of the watery environment on land where we're subject to the pull of gravity and all. So then it becomes very important in maintaining our body position in three-dimensional space in a one-gravity field. Where does it start? Well, it starts, there are 4 nuclei on each side in the upper medulla and lower pons. They're known as appropriately enough, the vestibular nuclei, because they're getting inputs exclusively from these balance organs, the vestibular system in the inner ear. For our tract, the nucleus that interests us the most is a large nucleus known as the lateral vestibular nucleus. So it is the lateral vestibular nucleus which is the source of the vestibulospinal tract. And notice that tract is very simple. It's uncrossed. It descends in the white matter of the medulla, and it comes down here, and we find it in the sort of the anterior lateral white matter of the spinal cord. And collaterals and terminals affect interneurons, which then affect motor neurons. Some of these fibers go directly to motor neurons. The majority probably first have a stop on an adjacent interneuron. And the role of this vestibulospinal system I've already mentioned to you. It seems to be, it's unconscious, see it's all occurring at the brainstem level. It is to maintain our position upright, assuming that's our position, in three-dimensional space. Obviously, if we were a three-toed sloth, our anti-gravity position would be holding on to a branch and hanging underneath the branch. And the vestibulospinal has made satisfactory adjustments so that it works primarily on flexors to hold us rather than on extensors to keep us thrusted down against gravity. So that's the vestibulospinal tract in a nutshell, and it maintains continuous anti-gravity tone. Its effect on the motor neurons down here, its effects are continuously tempered and modulated by fibers coming down from above, the corticospinal, the rubospinal, and other ones that we haven't talked about. If we were to make a lesion, separate here, make a cut just above where these nuclei are located, this would allow the vestibulospinal tract to act uncontrolled or unmodulated by descending systems. Does that upset you? Well, actually it does. It should, because in that case, the individual is thrown into a cartoon of anti-gravity position. This is my anti-gravity position when hopefully things are normal. If I had a lesion there, I would be in this position with a cartoon version of anti-gravity tone. Something like this, a hyperrigidity. A rigidity caused by the loss of descending modulatory effects from up above. In other words, the vestibulospinal system working uncontrolled, unmodulated. So that kind of so-called extensor rigidity is characteristic of a lesion just above our vestibular systems. Incidentally, in little children, we sometimes get a powerful lesion just above it, maybe due to a brainstem, an upper brainstem or cerebellar tumor compressing above that, and we get a cartoon of a cartoon of that hyperrigidity. The child is literally arched backward, and there's a special name for it. Just in case you run into the name, I'll put it on the board. The word is opisthotonous. And I hope you don't ever have to make the diagnosis, but it's there. Opisthotonous, pronounced opisthotonous. And this, I say, is the result of unmitigated activity in this vestibulospinal system. Let's go on to the last system I want to talk to you about. If you can make it, I see eyes shutting all over the place. And you see, make believe you just drunk some very strong coffee. Okay, this is mind over body. I just passed away. I just passed around some Pete's coffee. Pete's better than stuff that's around here. And it's very strong, lots of caffeine. And all of a sudden you can't wait to hear about this last tract, the medial longitudinal fasciculus. So let's talk about it just for a moment. It's a very interesting two-way tract. In other words, it carries fibers in both directions, up and down, but our main interest is essentially in the downward fibers, even though both are important. It starts in a number of spots. I've mentioned them on the sheet, the MLF does. It's called the medial longitudinal fasciculus. And I often tell my students, question? No. Okay. I often tell my students that the medial longitudinal fasciculus is known by everybody. If you have any doubts, next time you get into a taxi, ask the cab driver what he's heard recently about the MLF, and he'll usually take up the rest of the trip. Everybody knows about the MLF, the medial longitudinal fasciculus. What it is a tract system whose fibers come in part from a powerful visual reflex center here, the superior colliculus, from a group of accessory oculomotor nuclei which have effects on the motions of the eyes. You'll see why all this is true in a moment. From contributions from our friends, the vestibular nuclei, we were talking about them a moment ago, and also from contributions of the reticular formation in the brain stem. And they all contribute to an ascending, descending system that affects motions of the eye and motions of the body. Look at this. Some of these fibers go directly to the motor neuron without even an interneuron in the middle, so quite clearly they're important. But the most important thing is the MLF, which we'll see over and over again in a very characteristic position, approximately here. You'll see it. Here it's located here. What does the MLF do? The MLF coordinates visual tracking motions. To do this, it integrates. Now you might look at me just for a moment. It integrates motions of the eyes with the head on the neck, with the neck on the body, so that you have, say, automatic following motions. You don't have to program. The very fact that an item is of interest is enough to get that MLF tracking for you. And when your cat sits motionless on the lawn and watches maybe a squirrel or something, nothing can break that gaze. From our point of view, I can tell you how you can always identify the MLF in action. Go to a corner somewhere in the street, bunch of men standing on the corner, and a pretty girl goes down the other side. Watch those eyes. Oh, that's the MLF in action. So do remember that. So these are the descending systems that I wanted to share with you today. Now just a word about the laboratory, then we'll take another little break and get to the lab. I want to go over some material that's familiar, at least we've had it once, grossly. But I want us now to be able to look a little more knowledgeably about a few of these systems on the surface of the cerebral hemisphere. The motor strip, the premotor strip, the sensory strip, the supplementary motor area, prefrontal, all of these areas that we should know about. And then, folks, here's what we're going to ask you to do. And I'll ask for cooperation. You'll pick up your brains, of course, after I make a quick demo. And then you'll demonstrate these to yourselves on the outer surface. Now, I'm embarrassed because it's so hard for us to get brains today, and I have to keep some brains for the graduate course we're going to teach in the winter. So each pair of tables will have one brain. When we've done all the IDs that we can do on the outer surfaces, undersurface, and so forth, then I'm going to ask every alternate desk group to make the section to the brain that I'll show you how to make, so that we can look at the internal aspect of the hemispheres. We haven't really had that luxury. And I feel I've got to keep about half of the brains intact for the graduates.